Happening today, the New York City Council is expected to vote on legislation with perhaps the loftiest goal you could think of, the goal of extending life. It's an ambitious swing, but also desperately needed.
Why? Well, back in 2019, New Yorkers saw their average life expectancy plummet from about 82 and a half to 78 in just 12 months. So this legislation is trying to address health disparities, expand access to health care, and extend the average lifespan of all New Yorkers back up to 83 years by 2030.
And we've all been in this discussion throughout the commercial break. Why the decline? And as you mentioned, and there's some side effects of the pandemic that can be responsible for this as well.
Yeah, I think there's a lot of secondary effect. As we were discussing during the break, during the pandemic, I was working in the emergency room during the height of that pandemic when it first started. And although, yes, we had many patients coming in sick with COVID-19, we also saw that secondary effect. Doctors retiring early, offices closing, people weren't able to get their screening exams, children missing their vaccinations. I think all of those things contribute to that secondary effect of this startling graph. You can see that drop in 2020. And
that's a cliff.
Yeah, it is a cliff, in fact, and a lot of that is associated with the pandemic. But again, these secondary effects were so important and made us realize how valuable it was for prevention.
Well, now that we're on the other side of the pandemic, how do we climb out of that cliff to try to right what happened?
Well, I think it's first in acknowledging the drivers of what drove it. So we talked about COVID-19 and the secondary effects, but if you look at some of the other drivers, it includes chronic disease and diet-related illnesses. It includes screenable cancers, as we discussed, also overdoses, and maternal mortality. Those are some important factors that, as a public health establishment, we can work to change, but also what we can do in our normal life. There are many things that many of us can change in our everyday life that can help to extend our life.
I did a story on the Upper East Side, was hospital-driven, and they said you go to East 96th Street. North of East 96th Street, you see a much lower life expectancy. Why? Vegetable oil. South of East 96th Street, olive oil. People live longer. And they have better access to doctors, better education.
Fresh food.
Fresh food, 100%. But the oil thing made a huge difference.
It's so interesting that you brought that up, because as I was walking here from my office, one of the diets that's been most associated with longevity is Mediterranean diets. And a lot of that is focused in the use of olive oil, the use of nuts and legumes. But I think the key is in stepping away from meat-heavy diets. It's one of the things that we can help to change. Looking at meat as a side option instead of a main option, increasing plant-based foods. And then, of course, with that, you have to exercise at least 20 to 30 minutes a day. You want to make sure that you're getting in touch with your physician and getting your screening done, and then also getting that important sleep. There are certain studies that show those that get less than 7 hours of sleep have a significantly increased risk of early or premature death, which is incredibly concerning.
And then any governmental impacts that also, as these leaders talk about things to do, how can that play a role?
I think social determinants of health is really important to pay attention to. As physicians, we often think about the minute things, the medications, getting your checkups, but when we look a 1,000-foot perspective, making sure that people have housing, making sure that people have access, making sure that people have coverage. Those are important dynamics that we need to make sure every New Yorker has in order to help them live longer. And I love this saying that my mom always said, it's treat your body like a house you have to live in for the next 80 to 90 years.
Your mom.
We know when we treat our cars and we treat our pets better than we treat ourselves. So paying attention to yourself is really important.
And it's also, I think, to be fair, we spent a lifetime of getting people in the pattern of going regular doctor checkups. And then during that COVID time period and shortly thereafter, we just fell off that cliff and nobody was really doing it. So now we have to get people back in the habit. And I think showing you guys what we just saw today should help you say, I do need to make a doctor's appointment. I do need to get a yearly checkup. It's important.
It's incredibly important. And I was a part of that group. I missed my doctor's appointments mainly because I was working so much and it was difficult to get into that office. And so now hopefully this is a sign for many people to make that appointment.
And every single one of us had doctors retire. We had 3. You and I had 3 each. I mean, so make those phone calls, find new doctors, ask around. And also, you mentioned your mom, connection with other people.
So true.
Right?
So
connection with other people.
I'm so happy you brought that point up. This is the most difficult part of the year for me, to be socially active. I don't know about you guys. I want to stay inside, and everyone is annoying. And so for me...
Well, that's New York and it's winter, and it's true.
Between the holidays and spring are my most difficult times. But social activity is key to brain health. And we want to live not only long, but we want to have a great quality of life. We want to have our senses. We want to be able to communicate and cooperate. So making those social engagements is just as important as making those appointments.
No.
Loneliness can be deadly.
You're absolutely
And that's what COVID was.
Yep.
It's very true.
Yep.
That's
You
true.
know?
Time to do some house renovations.
Yes.
That's good stuff. Dr. Darien, always great to see you.
So
Thanks
good.
for having me.
Coming up, lithium-ion batteries, we know they're dangerous and often